Good morning. Georgia wanted me to show you her genius hack. So this is my toast for breakfast, which is lukewarm. We are going to wrap it in Georgia's heat pad, putting it on high. Yes, I'd be very proud. Live from London. Live from London.
Quick trigger warning and disclaimer for the girlies and guys.
Yeah. Okay, so I'm gonna so I can give you a top up, okay? You okay? Slightly feel your arm. Good. Okay, I'm just gonna make your vein bigger. You will just feel a slight pressure, like a feeling of push and pull.
Okay.
Probably try to tuck your chin down to your shoulders. Yes, exactly. Just makes your neck vein smaller so that the line doesn't go up your neck.
Okay.
It goes down where we want it to go.
Yeah, that's
Okay, I'm just gonna lift your arm.
And here we have Sleeping Beauty in her casket, recharging her batteries. Not sure if she's waiting for true love's kiss, or if she's just channeling her inner Sleeping Beauty. I guess we will never know.
Yeah, Friday today.
CT scan on my kidneys. Mr. Glasses organised CT.
Another day, another CT scan. So what does one do when it's been a slow weekend and you've not been outside for 5 days? You go for a cheeky evening hot girl hospital walk, of course. Let's go, girlies. Now what's more exciting than London's changing of the guard on a Sunday? The changing of my surgery dressings, of course. Stunning.
My dressings are all nice and clean. They feel nice.
Wow, don't sound too convincing.
And the guy who did it was so gentle. And actually see my incisions a few days later, because the first time I saw them was pretty much straight after surgery, wasn't it? Yeah, they look a little bit ugly right now, but they're healing, which is all good.
Now for a little update of the past few days.
What day is it? 21st. It's Sunday, the 21st of September. As you can see, we're still in London. You can't see because of my face, but that's the skyline from George's window. That's the Shard over there.
And that's your tour of London for the day.
Start again. So the plan was Georgia would go from St Thomas's to Guy's to have kidney surgery because she's been in a lot of pain in her right kidney with a stone that is travelling down the ureter.
I've got remaining stones in both kidneys in a minute.
Yeah, in both left and right, haven't you? So I emailed Mr Glass's secretary to say Georgia's really keen for surgery next week once she's had a good few days to recover, and would this be a possibility, because we did discuss this with him in July and that was the plan. So he was actually in St Thomas's Hospital doing some filming or admin work, and he actually popped up to see us, which was lovely, and he came in and said, right, let's do a CT scan. So as you've just seen, George has been for the CT scan the other day, had that, and we were informed that there is no stone in the right ureter, and that at the moment Georgia wouldn't need urology intervention. So we've not heard that directly from Mr Glass, but this is what the registrar that came to see us today has said. Now, in the meantime, Georgia has obviously, they've been trying to get bloods from Georgia, like post-op bloods, to check for blood clotting levels, because she's on like an anti-blood clotting drug, because she's had an organ removed and because she's obviously in the bed in the hospital. Now, Georgia has been seen by the IV team, the vascular team, who've been trying to get bloods from her and not been able to do that.
I had it's called a deep access deep access line, yeah, a deep access line fitted, which was
Fitted on the 19th.
you would have seen the you actually would have seen the footage for that.
Yeah.
Because I can put that in, it's not too graphic.
They came to Bedside to do that, didn't they? And all like
nice.
theatre stuff.
Yeah, it's very like surgical. They do cut your arm like surgically and stuff. It's not nice. But that was meant to be a PICC line. Unfortunately, it failed. They got halfway, and we think it might be scar tissue.
Yeah.
So it can be used as like for fluids and IVs. My deep access line is used for fluids, but it unfortunately can't be used to like
Draw back bloods. Yeah.
Basically. So I keep feeling like I always say this on the videos, but I do need a PICC line. The left lock one is suitable, so we are currently doing our best to try and get that done and fitted. I'm on the list.
Yeah, but because it's the weekend, it's obviously there's only like one guy or one doctor in IR that can do.
Staff.
Yeah.
It's very limited.
Very limited, and obviously there is an A&E in the hospital, so those patients are priority if it's an emergency. So.
But currently I can't get bloods, and I'm still not feeling
you're not.
at all, level-wise.
She's not feeling good at all, hardly eating anything. The night after surgery, she was eating a lot better than she has for a long time. And then last night and tonight, just not very much appetite at all.
Really quite severely low since surgery as well.
Yeah, it has.
They've been really trying to pick it back up, and it won't. I just don't feel different. Like I feel like how I feel like my other videos have been filming just dead.
Yeah,
literally.
And part of it will be you are recovering from a major operation, but actually something's still not quite right. I've gone on to her. So in the NHS in London, so guys in St Thomas's, they have an app and it's called My Chart, and you can actually log on, and as a patient you can view all your test results, blood results, and go really in depth into those results to see what level the blood tests have come back as and what each of those levels mean. Now George has come back as her albumin is really low and her sodium is really low, The potassium, it said there's no result for, which again, that's really concerning, because last year those were the things that were really low, which were causing us a lot of problems. So those do need to be tested. So we are pushing for the PICC line. We have been told by the head nurse that that will be done tomorrow, and that Mr. Glass is coming over from Guy's to see Georgia at 8 o'clock. So we can discuss with him, obviously, the PICC line and going home on the PICC line. Because today we were told by a registrar that she can have the PICC line for bloods, but then she wouldn't be allowed to go home on with the PICC line, which just doesn't make any sense at all for the safety and ongoing care of Georgia, nutritionally and, you know, nutrient balance wise.
And also, since I'd say past 2 days, I've really noticed my legs swelling up. Now, this is also very similar to what happened last year with my levels, and it's just kind of making sense. And maybe my kidney, things are obviously very off balance, and my legs are hurting, and I can feel it, like they're really uncomfortable all around my legs and my ankles. They're all just really swollen, aren't they?
Okay, take 3.
Sorry, someone did not, because I was being hooked up to some ibuprofen to help with the pain. But there's been basically a 29% drop in my weight, and I still haven't, since being here, been referred to or been seen by.
Take 4.
Better. And then turning my neck. So I've actually not been seen by the dietitian or the nutritionist since I've been admitted to hospital, which is concerning because last year I was, and I'm obviously a more of a concerning weight this year. So hopefully that is going to be the plan, where I'm going to be able to be supported by the dietitians and nutritionists here, because losing 29% of your body weight is, you know, not something I can manage on my own at the minute. My health has scared me a lot, and especially with surgery, you know, so going through that surgery that, you know, 2 days ago was terrifying, because that was the worst that I felt, like not being able to breathe after it. It was all to do because I was so underweight and malnourished, and it is, and that's what my recovery guy said. It's because you're not fit enough really for the surgery, and it's a term thing as well. And I've not even mentioned my swollen legs. I can't even remember that. My legs have
I just
really
mentioned
sore.
about the blood levels on my chart, didn't I? Yeah.
Yeah, blood levels were on my
So-
chart, not good.
Low albumin causes swelling. And Georgia has just been weighed again, and her weight has gone up to 18 kilos. Now, you'd think, oh great, she's put weight on. Now, that isn't weight from eating, that is water weight, because she's got low albumin and low sodium, and we don't know what the potassium level is at the minute. So again, more reason to get the PICC line, because she needs regular bloods to make sure all the levels are okay. She's going to need the line in for possibly fluids, possibly TPN, which is an enteral, an intravenous feed, like nutrition via the vein. But yeah, but obviously they're saying Georgia doesn't need to go home on a PICC line, because nobody's actually said she needs this PICC line because of this, and this, and it's like,
I can't get regular bloods, and I've been needing regular bloods now for over a year, and it's like, I've not got that support, I've not got that safety net.
no,
Like everybody else can walk into a GP and say,
and just stick
I
their
don't
arm out
feel
and get
well.
bloods. Yeah.
And I've tried at my local hospital, and it's just been failure after failure. And during this time, I've just been at home deteriorating in this, you know, situation, and it's got me to here. It's like I don't look, I don't look healthy, and I don't feel good at all. And I know my body, don't I?
Of course you do.
You know me as well.
Yeah.
Like,
And obviously we don't want to go home and then she deteriorates further, and then we're back to square one.
if I went home like this, things wouldn't change. I would still be in my bed just the same, like before.
And that's not a
surgery.
life, is it?
No, I've got no quality of life at the minute, and I
No.
haven't been. I'm basically just wasting away, and that is pretty sad.
Yeah.
At my age, when I know that's not my life, and that I want
No.
to be getting better, and we need that plan put in place, don't we?
Yeah, so we'll speak to Mr. Glass tomorrow, and hopefully he will. I mean, he's always on George's side. He's a great
It's incredible.
support to us as a family. Obviously, we're from Warrington, and he's a surgeon in London. He hopefully will have her back tomorrow, and will authorise the PIC line, and
As soon
then
as the PIC line's in, we can basically transfer everything to home.
yeah, the dietitian, the nutrition team can see you at home, but at least the PIC line's in.
Support at home, yeah.
Yeah, and we can go to the urology team in Warrington
Yeah.
if we're worried or you get more pain. And
Yeah.
then we know you'll come back for kidney surgery. That's
Yeah,
part and parcel
that's
of your
okay.
life.
Just got to accept that.
But let's get you right after this.
Yeah. Suck it up, Queen, because you're gonna have to.
Cornichons! Now gone to bleep the
Then,
IV
like,
team.
watered down blood,
Yeah.
I was like, oh my god.
See you all on Friday, girlies. Thanks for watching.